This patient was referred to me for endodontic treatment of tooth number 2, upper right, second molar. Patient recently started to have some symptoms. He went and saw his dentist, and his dentist noticed a sinus tract on the buccal marginal gingiva and referred the patient to us. So take a look here. So that's the tooth, right? Composite. You can see lucency right there, and to some degree there as well. And take a look here. And that would be the tooth here, and you can see the sinus tract right there on the marginal gingiva on the buccal side of the tooth. Right there. So percussion tender, palpation tender, probings in this area were 6 to 7, 8 millimeters, but no signs of a crack or anything like that. I examined the tooth under a surgical operating microscope. I discussed options with the patient. We can go ahead and try the root canal, no promise or guarantees. If root canal works, great. If it doesn't work, you have to pull the tooth. Or the other option would be extraction. And patient said he wanted to try to see if tooth could be saved. He wanted to try the root canal, and that's what we did. So take a look here. Let's go to the clinical. Let's go ahead and go to the clinical. All right. All right, so here it is. I already accessed the tooth.
So this tooth has 3 mesial canals.
So the tooth has 3 mesial canals, as I just said. MB1, MB2, and MB3. And we're talking about tooth number 2.
Tooth number 2, upper right, second molar.
Upper right, second molar. So it has MB1, MB2, MB3. The chances of upper second molars having an MB2 is about 40%. And this tooth has an MB3. Also, MB1, MB2, MB3. So that's what I'm doing right now. I'm using my number 10C file in my M4 reciprocating handpiece. The canal is filled with, canal and pulp chamber are filled with 6% sodium hypochlorite. And I just went to my estimated working length in all 5 canals. So MB1, MB2, MB3 here. That's distal buccal and then palatal. All right, so there you go. You can see it.
What do you have it on?
Have it on 23.
The 23 is the last one, is the palatal. So I do the palatal last always.
So let's see. Now I'm using my electronic apex locator to get the working lengths. As you can see right here. All right, so there you go. So
This is 23 or maybe longer. What's the palatal?
I got 23, 24.
so let's see what the MB1 is here.
Okay, tell me what this is.
That is 23 and a half.
23 and a half.
23 and a half.
MB1. So I'm gonna fast forward. We basically are getting the working lengths here. The working lengths were between 23 and 25 millimeters. So let's just fast forward here.
That's what this is, a little loose. Hypo tooth.
All right, so you can see MB1, MB2, MB3, DB and palatal, 6% hypo. I'm going to my next file. Remember, I'm just creating a glide path now to my working length that I got from the apex locator.
23?
So let's see what file. Okay, this is a 10, number 10 file, 23 millimeters. And there you go, see? The M4 when I run it at 1000 RPM, I'm not only negotiating and instrumenting with it, I'm also sonically activating. So I'm in MB1, I'm gonna go to MB2, MB2, MB3, and I'm gonna go to, there you go. I'm just gonna instrument like this. Then I'm gonna, of course, after each file, copious irrigation with 6% sodium hypochlorite. Then I will go to the next file. So right now I'm still working on these canals with the number 10C file.
That's the third one.
I'm gonna go to DB now. That's the DB canal.
Number 15.
All right, then I'm gonna go to my number 15C file, 23 millimeters. And here it is. I'm gonna repeat the same process. I'm gonna go to my working length with the number 15, and as you can see, I'm brushing. The canal and pulp chamber are filled with 6% sodium hypochlorite. All right, so let's just fast forward again. I'm just instrumenting all the canals again with that's the number 15C file attached to my M4 reciprocating handpiece. Again, copious irrigation with 6% sodium hypochlorite. All right, so that's my number 15 still. All right, so let's go ahead and, yeah, you can see I'm activating, instrumenting and activating. So now I'm gonna go to my number 20 flare file, and I'm gonna use a 21 millimeter flare file to just flare the coronal to mid thirds of these canals with my flare file, which has a 5% taper. I'm gonna attach it to my M4 safety handpiece, and as you can see, I'm just flaring, okay? I'm brushing and flaring these canals. And again, copious amounts of 6% sodium hypochlorite. All right, you can see that's still my number 20 flare file. All right, so let's go to the next video. Again, this is my flare file, number 20 flare file. I'm just flaring the coronal to mid as far as he wants to go, basically. I'm not gonna force it. All right, so let's fast forward again. Copious irrigation with 6% sodium hypochlorite after each file use. This was a necrotic case, all right? So here goes the first NiTi file. All right. These are E-Flex S by 8 Teeth. And again, I'm brushing with them. They're shaping files, shaper files, and I'm just brushing with them. I run them at 350 to 400 RPM. And I don't force them. I just let them go as far as they want to go. Remember, I already created a glide path and prepped the coronal to mid-third of each canal already. So I have a glide path to number 15, and then I use my number 20 flare file to flare and open the coronal to mid-thirds of these canals already. So there is very little force applied to these NiTi files. I don't force them. I just let them go as far as they want to go. Again, copious irrigation with 6% sodium hypochlorite. All right. So I didn't like the fact that I couldn't go to my working lengths with the first NiTi file. So right now I'm using a number 20 stainless steel K file attached to my reciprocating handpiece, and I'm creating a better glide path to my working lengths. All right, so this is a number 20 stainless steel K file. And I'm opening these canals more because I didn't like the fact that the NiTi file was struggling to go to working lengths. Again, copious irrigation with 6% sodium hypochlorite. Next canal. Again, this is my number 20 stainless steel K file attached to my M4 reciprocating handpiece.